All right, so on behalf of the Independence Chamber of Commerce and the City of Independence, we want to welcome you to First Friday. We've been doing First Friday now for about 5 years, a little over 5 years, and we always have a really good crowd. And this morning, I am so excited to let you know we have a packed house. We're at maximum capacity. That means there are 10 of us here today. So we are here for First Friday, and due to the governor's executive order to stay at home, we are doing it live stream on the City of Independence's Facebook page. So be sure and check that out. We have some great speakers lined up for you this morning. We have Tricia Purdon, who is here as the Executive Director of the Montgomery County Action Council. We have Dr. Michelle McGuirk, Chief Medical Officer and General Surgeon for Coffeyville Regional Medical Center. We have Becky Mitchell, who is the director of the ER and Independence Healthcare Center from Labette Health. We have David Cowan, Independence Public Safety Director for the City of Independence. And we have Rick Whitson, Montgomery County Emergency Director for the county. And hopefully joining us a little bit later potentially might be Carolyn Muller, who is the administrator for the Montgomery County Health Department. We always have a sponsor for First Friday, and because we're doing it live stream, we didn't need a sponsor today because we usually provide breakfast, which is muffins and fruit and hot coffee from Annie Mae's. But last night at about 7:45, I got a text from Terry Trout, owner of Annie Mae's, making sure that he had us taken care of this morning. So he provided coffee and muffins on the house, and we appreciate his sponsorship, of First Friday this morning. I want to kick it off by giving you some updates on some things that are happening in the community. First, we want to make sure that everyone is filling out their census. So this is my census form. I got this in the mail. I have to admit that I left it on the countertop for the last 2 weeks, and last night I opened it up and I spent 7 minutes filling out my census. It did not take long at all. It is very, very important. It's not only our civic duty, but it's how our community is able to plan for the future because our funding depends on that. So make sure that you fill out the census. The statistics show that for every household that is missed, $47,000 is lost to our community. So you can either spend 7 to 10 minutes and fill out that census form or create a $47,000 loss for our community, and we do not want that to happen. So please fill out your census form. Also, we have Love Independence Day coming up. So everyone knows that the last Saturday in April, or maybe you don't know, but the last Saturday in April is always our Love Independence Day. This is our 5th anniversary for Love Independence Day, which, if you're unfamiliar with it, is a complete day of total random acts of kindness. In the past, we've had a lot of housing projects that have taken place that day through the community missions for improved housing. Those projects are still going to happen, but they will happen later in the summer, and we will call that Love Independence Day 2.0. But for now, we want you to really focus on random acts of kindness throughout the month. So we're not just going to do Love Independence Day on the 25th. We want you to spread love right now through every day of the month, because it's really important that in this health crisis that we're in, that we extend grace to each other and we extend love. So that's what we're hoping that everyone will do. So on that day or during this month, we want you to think about doing some things like paying it forward in the drive-thru. So that's social distancing. Don't get out of your car. Just go through the drive-thru. Or pay someone a compliment, totally free. Leave maybe some extra laundry pods or a dryer sheet in a little baggie at the laundromat if you're someone who uses the laundry facilities there for the next person. If you're a Sonic person, maybe put 4 or 5 quarters in a baggie and tape it to the menu for the next person who pulls up during happy hour, and they can have a happy hour drink on somebody else. Maybe when you're using curbside delivery at Annie Mae's or some of the restaurants downtown, you can buy an extra muffin or extra coffee, and they can surprise the next person who comes out. Lots of ways to do that. Pay for someone's food in the drive-thru. That happens a lot, but let's do it even more right now. Pay it forward in the drive-thru. Buy a potted plant and put it on someone's porch, or some flowers for someone. Here's some easy ones. Call a friend and reconnect. Write a thank you note to someone. Share a Facebook post of love to somebody. Make an online purchase from one of our small businesses. Order takeout from one of our local restaurants, because they need our love now more than ever. So start thinking now, today, what you can do to share love through the entire month of April for Love Independence Day. We're going to open up a Facebook page for Love Independence. It should be opened up maybe later today or tomorrow. And we want you to, when you are out doing your random acts of kindness, to tag the Independence or the Love Independence Facebook page so that we can capture all the love that is happening in our community. So be sure and tag Love Independence, and the Facebook page will be launched later today. So as I said, we kind of kicked off Love Independence for the whole month, but we kicked it off a little early. We are having a Love Independence food drive right now. So we know that because of the health crisis we're in, our food pantry is going to be used even more than is being used typically. So we're wanting everyone to drop off non-perishable food items at the chamber office. The chamber is at 616 North Penn Avenue. We're open Monday through Friday from 8:30 to 5. We're closed from noon, but I leave the first set of doors open so you can drop off your food there. We need canned food items such as vegetables and fruits and soup, canned meats such as tuna and chicken, and breakfast food. The kids are home from school right now, so we need extra breakfast food such as cereal, and peanut butter is always good as well. So because of the extent of the health crisis, we're in need of some baby items such as diapers and formula as well. So if you could donate those items, that would be appreciated. And if you are a business and you have some items that maybe your employees are just bringing to work and you want to collect those items, then you can call Brian Norvell at the Hub, and he will come by and pick those items up and deliver them to the Community Access Center, which is the location of the food pantry. And the number for Brian is 926-0708. Also showing some love during this time would be First United Methodist Church and some community volunteers. They're loving people in our community by offering assistance to seniors and homebound individuals with grocery shopping and medication pickups. So if you are somebody who would benefit from these services, please call the number at the First United Methodist Church. The hotline is 331-0719, and they'll give you more information. They'll make arrangements. And the services are offered from 8 to 6, and they will make payment arrangements when you call and schedule that. So again, that number is 331-0719. Our pastors, ministers, and priests have been demonstrating love out in the community by participating in a prayer service. It was a community prayer service a couple weekends ago, and we were definitely blessed by having them pray for all of us. I want to let everyone know that we have 37 churches in our community. So if you are someone looking for a church home or an online service, you can look on our Facebook page later today. We're going to publish the church listing, and the Chamber's Facebook page is Get Independence. So you can look for that later on today, and we will make sure we get that information out to you. I might also mention that the churches are going to be taking turns gathering in the parking lot of Labette Health, the ER center, and they will be praying over the healthcare center, the healthcare workers, the patients, and the cancer center. So if you want to check with your church and see if they've scheduled a time and a date to go out into the parking lot and pray over the facility, be sure and do so. The evening times are best for Labette Health and the weekends. So we're asking that all churches, and there's a group email going around between the pastors, but that they communicate and pick an evening and let all of their parishioners know that a certain church is going out on a certain day, and then they'll show up in that parking lot and pray over the facility. Another way to show your love is, because Easter's coming up, and to show your love to the kids of our community and to the fire department, is they are participating in an Egg Your Yard event. And this is a fundraiser for them so that they can pay for a second set of bunker gear to help keep them safe. And so we're wanting to support our fire department, and we're also wanting to support our kids in the community. So if you have neighborhood kids, if you have grandkids, your own kids, maybe you know a single parent out there who has some kids. That single parent might be, or even if there's two parents in the house, they're trying to work, they're trying to homeschool, surprise them by signing that family up by just turning in their address and paying $10 to have the fire department come by the night before Easter. They will be practicing full safety while they're dropping eggs in those particular yards. The number to call is 332-2504 to pay for those eggs and to provide them with an address. It's a great way to love the kids of our community and help our fire department. Take advantage of the stay-at-home order and clean out those closets, the garage, pick up your yard, because the City of Independence and the beautification team is loving Independence once again by offering free dumpster service this spring. So tomorrow is the first day of 8 weekends that they will be doing this. There will be in total about 10 different dumpster locations, but on any given Saturday that's been selected, there are 6 locations. This Saturday, tomorrow, there will be 6 dumpsters out, and the locations are 13th and Walnut, Burns and Walnut, Park Boulevard and Sycamore, 900 West Laurel parking lot by the temporary City Hall, 11th and Catalpa, and 21st and Taylor. So get out, clean out those, like I said, that garage, the yard, the house, and fill up those dumpsters, and let's beautify our community. Remember to like the Indy Responds Facebook page. So this is a Facebook page that was created. Their speakers might be talking about this in more depth, but this Facebook page was created by the city and MAC and the Chamber and Main Street and the Housing Authority as a way for all of us to get good, current, accurate information out to you. There are also respond pages for Coffeyville, Caney, and Cherryville. So pull that up on your cell phone and like Indy Responds. I want to make sure that you all know that the Blood Mobile will be here. Instead of the 9th, they've moved to the 20th from 11:15 to 5:15. They will be practicing social distancing, and proper safety measures will definitely be taken. First Saturday recycling has been canceled for tomorrow, but Tuesday recycling is still in place. Every Tuesday from 11 to 1, you can drop off your recyclables at the sanitation yard at 21st and Maple. And because sometimes the sanitation yard might be unmanned, please sort your recyclables, bag them separately, and leave them on the concrete pad to make it easier for our sanitation workers to separate those recyclables. And if you were not able to watch or read about the City Commission meeting that took place yesterday morning, I'm very excited to report that our city approved a $400,000 grant that will be divided up into 5,000 grants for our hospitality in businesses that qualify for that. That might be being discussed in more detail later on, but we're really excited about this opportunity and the effects that that will have on our hospitality businesses. And I want to just say appreciation to our City Commission for that and the Economic Development Advisory Board for their leadership and support. I know it means a lot. I made a lot of calls to these businesses who would potentially qualify. We think there are about 65 to 70 that will qualify. And many of them, seriously, were almost in tears when we had the discussion about this opportunity. So that definitely qualifies as loving Independence. And as I wrap it up, I want to let you know that we're going to have a parade of love. So next Friday, April the 10th at 6 o'clock, we'll be gathering out in the Park Oval for a parade of love. Last weekend, I think it was, there was a group that put together a community cruise, and there were so many people out cruising the community, having a great time, doing proper social distancing, and we decided that we wanted to do something very similar. We'd already had something planned, but we wanted to push ours closer to Easter, so we're putting in place a parade of love in conjunction with Love Independence Day, and as I said, it will start at the Oval. No social gatherings, please. Everybody needs to be in their cars. And you can watch the parade from your yard, from your porches. You can take your immediate families and stand along the parade route, which we will publish on our Facebook page over the weekend. And it's going to cover from the north end to the south end. I've mapped it out. It's about 10 miles long. It'll take us about 35 to 45 minutes to drive it, but we wanted to cover everything. We're going to go by Eagle Estates, which is a senior living facility, Pheasant Point Apartments. We're going to go by the high school because we want the high school seniors who have missed out on so many fun things this year. We want them to park their cars with their families in the parking lot so that we can recognize them as we drive by and honk our horns and everything. We wanted people to decorate your cars and have balloons on them and things like that. But anyway, on the path, we're going to go by medical lodges and Country Place Senior Living. We'll be by Jefferson School, the backside of Eisenhower, Garden Walk Apartments, Penn Terrace, Penn Manor, Montgomery Place, Grand Villas, and back to the park. So we're working with the school to get the word out, and we want you to drive your antique cars, your sports cars, your regular cars, and we want you to put posters on them thanking our healthcare workers, thanking our teachers, our businesses. Put birthday wishes out there. My mom is 81 today, so happy birthday to my mom, Charlotte Muse. I will be having a poster on a car as we drive through the parade and recognizing that we can't celebrate her birthday. Other reasons to celebrate. Sean Wallace, our chief of police, is a new grandpa again. Miles Elliott was born on April the 1st, so I think that there should be some posters recognizing that special birth too. And the Easter Bunny, I've heard, is going to be in the parade. So we will be practicing social distancing and all types of safety, but we want to get out and have a great parade of love. I want to thank our police, fire, and EMS. They are not here today to be speakers, but I want to publicly thank them for everything that they are doing, as well as all of the speakers that I'm about to introduce. So with that, it is time to get started. At this time, I would like to welcome to the podium to speak to us about COVID-19 and the effects that it has had on our business community and the economy of the county. Would you please welcome Tricia Purdon, the Executive Director of the Montgomery County Action Council. There should be some clapping, Tricia. Yes, there you go.
So it does feel a little quiet in here, so thank you for the applause. Thank you all so much for watching today and everyone here for joining us. It has certainly been a trying time, especially the last month, for our area businesses and industry. I really want to touch base and talk to you all about what's going on in our county and some of the positive things we're hearing from our business and industry. It has certainly been a time for collaboration and innovation amongst our industry and small businesses, large and small. We've seen companies that have retooled, have redone some of their equipment and machinery to allow for reproduction of products that are in critical demand in our supply chain, for healthcare workers, all the way to other industries that are making products for healthcare workers and PPE equipment. So we're grateful for our area employers who have done that. We are hearing from area industries that they are doing social distancing. A funny example to lighten the mood here is we heard from one of our industries that their supervisors, rather than making sure everything's perfect, are walking around with yardsticks. And if they see any employees standing close to each other, they're whacking them with a yardstick. So that might be a good tip for any of our business and industry who are looking to implement some social distancing guidelines in the workplace. But that saying, we know that we have a lot of businesses in Montgomery County. Actually, I would say probably a majority of our businesses in Montgomery County are deemed essential according to Governor Kelly and her executive orders. And knowing that, I want to encourage all of our businesses to make sure that you are following your social distancing guidelines. And there's some excellent information on how to do that in business and industry that we've posted on our website, actioncouncil.com. Also, on that note, I would like to make sure all of our business and industry make sure they go to our website, because you do need to fill out a form to verify if you are an essential business. And during this time, it's really important that we make sure that all of our business and industry complete that form so we know exactly how many businesses are currently operational in Montgomery County. We know how many employees are at those businesses and what those operations might be to support our essential industries, such as healthcare. We've had businesses that say, well, I supply products specifically to our hospitals. You are definitely an essential business, but make sure you fill out that form so our governor knows who is still in operation and who still needs assistance. The second program I want to talk about, and that Lisa excitedly announced is the Independence Grant for retail and hospitality businesses. We are so honored to be a part of that process with the City of Independence and the Economic Development Advisory Board. That truly was a phenomenal collaboration amongst several industry leaders and community members to make sure that we're really helping those who are most in need in our community. And we can't thank everyone enough for participating. That link is live, and you can fill it out online. It's for a $5,000 grant to keep you operational or sustain your business until you're able to open again. So more guidelines are out there on the city's website, as well as Montgomery County Action Council's website and the Chamber's website and Main Street. And so all of those resource partners are available to give you guidance on that. The second program I wanted to talk to you about are some of the SBA programs that came out from the CARES Act and from the Coronavirus Response Act that came out a few weeks ago. The first program they're calling the EIDL, Emergency or Economic Injury Disaster Loan. That program allows for a business to get a 30-year term loan at 3.75% interest that will cover their expenses for 6 months, and that's what your maximum loan application is for. The great part of this program is specifically for those businesses maybe who are startups or businesses that have expected to have longer term impacts on this. They can take advantage of very low interest rates to help keep their business going during this time. The other part of this is that it does include a $10,000 forgivable aspect of that loan, and it is guaranteed a $10,000 forgivable aspect as part of that application. So those that fit those qualifications, I encourage you to apply for that. You can also apply for the second program that came out in the CARES Act, which they're calling the PPP, the Payroll Protection Program. That program is for a loan for 2.5 months of your payroll expenses, which include compensation, workers' comp, benefits, all of that's included in your payroll, utilities, mortgage payments, and interest. That does not include loan payments that you might be making on equipment or machinery, but specifically for your business and rent. So 2.5 months of that total is your total maximum that you can apply for that program. Those go directly through our local lenders, and I will say that I got word from our area banks last night that they all received the guidance from the SBA on what those terms will be. So they are going to be flooded today with applications, I'm sure. And if you're interested in applying, feel free to contact my office. Feel free to contact your local banker to apply for those SBA 7A loans. The great part of this program is that 8 weeks of those expenses are forgiven as part of this loan. It is a 100% guaranteed SBA loan, SBA 7A loan, which means that the bankers, the SBA guarantees those loans to our local bankers, and they're reimbursed for those funds that they issue. So 75% of your payroll needs to be a part of that application, and it's based on your total payroll amount for 2019. So your average payroll, you take your average payroll amount, excluding any salaries over $100,000, and then you take that, divide that amongst by 12, and then take that times 2.5, and that's your total payroll amount. 75%, you need to exceed the total amount of your 2.5 months. 75% needs to be your payroll threshold. Anything less than that will not be forgiven. So you need to make sure that you hit that 75% threshold. Again, that runs through your local banks, so please contact your local banker to apply. It's a great program, especially for those that are keeping their employees on staff, and that is a key component of this, that employers have to keep those employees on their payroll. They have to maintain the exact same amount that they maintained for their average of 2019. So if you've already laid off your employees, if you've already had to make some serious cutbacks, I would suggest you look at the EIDL. You can apply for both programs. However, you can't double count your payroll. You can't double count your expenses. So make sure that when you apply for this program, if you apply for the EIDL, exclude your payroll and those utility expenses, and then apply for the rest of the amount for your operating expenses for 6 months on the EIDL, and everything else can go on your PPP program. Okay, that's a lot of detailed information really for our businesses. Now to really focus on our very small businesses, which are, our sole proprietorships, 1 and 2 mom and pop businesses. The state of Kansas issued a program to allow for communities that have CDBG funds, which luckily Montgomery County does have, to issue loans to our businesses. Our loans are for $5,000. They're at 1% interest. And these loans are specifically for those businesses with 5 employees or less, unless you are a company that makes PPE equipment for a healthcare provider, and you have to verify that you have that in place, and then that 5-employee number is excluded. You also have to make sure that 51% of your employees are low to moderate income employees, and that those thresholds are fairly low, unfortunately, so it's a little bit of an oxymoron, but that information is out there on our website, so please take a look at that. If you think you're eligible to apply, please contact me. Okay, a couple other good news. Kansas Children's Cabinet has a grant out there for our child care providers. It's $500, but it's for any child care provider, including our at-home child care providers. So please go to our website. We have that information posted for those to give you a little bit of a leg up during this challenging time, because we know you were all hit as well. We also posted last night on our Facebook and I think on the Indy Response page, there's grants for restaurant workers. If you've been displaced due to a restaurant or something like that downsizing, there are $500 grants available from the National Restaurant Foundation that they're putting out. Lastly, I want to touch on unemployment. And this is the extremely challenging time that I hate to even have to discuss. But for our employers that are facing really hard decisions right now to keep their business open, please go to getkansasbenefits.gov. There is a spreadsheet for our employers to fill out that automatically puts all of your employees that you might have to lay off or furlough right now on unemployment immediately. Right now, the system is overrun, as I'm sure many of you have heard, with people applying for unemployment. This spreadsheet bypasses that system and allows your employees to get benefits immediately, especially if you've had to do these layoffs or furloughs due to COVID-19. I can't emphasize that enough. The backlogs we're seeing on the unemployment websites, the crashing that we're seeing, we just don't want our employees here in Montgomery County and Independence to be affected by that. So please utilize that spreadsheet. Everyone else, if you are not part of a larger company that might utilize that spreadsheet, please go to getkansasbenefits.gov. There's lots of programs out there. In addition, if you're unemployed or furloughed and still need to be employed, there's a great partnership out there that Kansas Department of Commerce rolled out a couple of days ago, that they're matching those essential businesses that desperately need help right now with employees that are desperately needing work right now. So please go to that website. We've posted that also on Indy Responds, as well as our website, that matches those people in our areas that need assistance. So if you're a business that needs workers, or you are a worker needing a job, please go to that website and help us with that matchmaking program, because I'm sure our healthcare companies and businesses that are deemed essential could definitely use the extra help right now. Lastly, I'll say if you can keep up with our website, we have a lot of great information out there for our businesses, handy systems that we're seeing other businesses use, best practices that we're seeing in the workplace in regards to social distancing and preventing the spread amongst our business and industry, especially those that are deemed essential. Just follow that website, follow our Facebook page, and I look forward to serving all of you as we get through this together. Thank you so much.
And we are taking, I can't remember if I already said this, but we are taking questions on Facebook for our speakers. If a question comes in that we think is more appropriate for a speaker, that will speak later on, then we will hold that question and address it when it is applicable. So we're going to move on to all of our individuals who are involved kind of in the healthcare section of all of this. And our first speaker is Dr. Michelle McGuirk. As I mentioned before, she's the General Surgeon and Chief Medical Officer for Coffeyville Regional Medical Center.
Thank you so much for the welcome this morning, and it really is a pleasure to be here kind of chatting with everybody. I'm going to try to just do a little bit of an introduction first of all, and then talk about some of the goals of this relatively brief presentation that I have for you, and then I'm happy to field any questions if those arise. First of all, again, I'm Dr. Michelle McGuirk. I am a general and trauma surgeon and the Chief Medical Officer at Coffeyville Regional Medical Center, and also a member of the COVID-19 Task Force Committee, which meets every single 24 hours without fail, including weekends, and that has been going on for almost 2 weeks now. First thing first that I can tell you is that from the first time we had our task force meeting to today, cases in Kansas have more than quintupled. So that's something that, you know, we think maybe in some ways that we're a little bit distant from everything that's happening, certainly in New York and things of that nature. But we do need to kind of keep vigilant and be aware that cases do continue to increase as things move into the Midwest. As you can probably appreciate, a lot of us in the medical field are kind of having to wear some new hats. Certainly as a surgeon, trying to kind of field questions on COVID and decide what's the best thing to do for our community has been a challenge. With that being said, if there are any questions that I don't have the answers to, I'm more than happy to investigate those questions, and we can always post those on our Facebook page later on. Briefly, what I'm hoping to do this morning is talk very specifically to the members of Montgomery County and Southeast Kansas, not necessarily to provide a big overview of everything that's going on COVID-19, as I think that all of us have been kind of inundated from the news and things of that nature. But from a medical perspective, just kind of give you a little bit of an update on how we're kind of feeling at this time and the collaborations that are going on in Southeast Kansas. First and foremost, I really want to give a huge thank you to all of the folks who have donated masks, sewn things for us. You know, obviously, Tricia had also mentioned that we have some folks who are doing 3D printing of face shields and other things of that nature. We've had businesses who have actually brought donated pizza for us. Actually, just yesterday, Shoe Sensations and Pizza Hut donated, you know, tons of food for us throughout the day to kind of keep morale up and to keep us fed and in this busy time. So thank you so much for understanding that you guys are really helping us, and that's just amazing. We also really appreciate your patience in understanding that, you know, for example, at Coffeyville Regional, we went ahead and followed the national guidelines of a no visitor policy. We know that that's very difficult. There are some exceptions to that. So for our elderly patients who may be facing an end-of-life crisis, or for laboring mothers, as an example, we've made some exceptions. So it's not as though absolutely no visitors of any kind, but we are asking folks to understand that for the protection of their loved ones, as well as the other healthcare providers, we do appreciate your patience in understanding that. We know that restrictions and closures of all the different types of things that are happening is not easy. We don't ask that lightly. You know, as we move through this crisis, and again, thinking that it may in fact continue to escalate yet a little bit here in Kansas before things get better, we depend on your support. So thank you so much to the community. According to recent projections, we do think that the worst of the COVID crisis in Montgomery County is expected to be approximately the 24th of this month. So later yet this month. Clearly that's not going to be an exact date, but again, be vigilant, because we do need to continue with these social distancing and all these measures, which at times probably feel a little bit ridiculous. So here we are, most folks, you know, are out, we're healthy, we're, you know, that kind of thing. But again, be aware that we potentially have not seen the most cases that we're going to as yet. Something else that's been very, very reassuring is a lot of collaboration that's going on with other counties surrounding Montgomery. Both myself and several of my colleagues at Coffeyville Regional have reached out to other counties in Fredonia and Wilson and places of that nature in order to discuss what are our resources. This is a time for collaboration and for solidarity with one another. It's not a time to kind of keep to ourselves and every man for himself. This is certainly a time that we are expecting this influx of cases to potentially worsen. And so I do want to reassure you that those resources are going to enable us to take care of lots of patients and lots of cases as those arise. We recently, just as of even yesterday at our task force meeting, have essentially acquired a protocol for therapy of these patients who potentially could get very ill and be presenting to our hospitals. These are FDA recommended protocols, both for respiratory therapy, for medications, and we will be following those guidelines as we move into this. And please refer to our Facebook page at any time, again, for any phone numbers, questions, things of that nature. In particular, we continue to recommend that folks please call ahead to the hospital and to your clinics. So many things can be accomplished over the telephone, at least to start with. Certainly, if you develop very, very severe symptoms that are way beyond just a standard cold, because that's what most of the coronavirus patients experience, are symptoms similar to a flu virus. However, if you develop worsening symptoms that cannot be handled at home or for any other questions, just please call ahead first. That's going to help reduce a lot of potential exposures of elderly patients and things of that nature. We continue to take care of all the other illnesses in our community. So, cancer doesn't stop for coronavirus. We still need to do chemotherapy infusions. I'm still operating on patients. All those different things are not stopping for COVID. So, with that being said, that is a huge part of why we're asking for you to help us conserve our valuable protective equipment, as well as, we have reduced our elective cases in terms of things like routine colonoscopies and cataract surgeries, and all the things that kind of help continue to move, our hospital forward. So that's been very difficult for us, and again, that is because we are trying to conserve all of our valuable resources as we potentially move into a worsening area of cases in Kansas. We also want to encourage all of the patients and folks in the community to please be honest with your providers. We've had a couple of situations where we get concerned that our first responders, such as EMS and fire, have not had kind of the complete information that they need when they come to a patient's home, because folks may be feeling they're afraid to sort of admit to their symptoms, or that we're going to, not treat them, with the same care because of having COVID. That is not the case at all. Please keep in mind that it's no different than having accidentally contracted a sore throat or the flu. So just be honest with your provider and your first responders so that we can, again, be protected appropriately, and we're going to care for you, okay? Last thing I just want to mention before I open it up to any questions, if we have any, just continue to please stay positive. We do know that there's an end in sight. We need to stay vigilant, certainly, but stay positive, and we are going to come through this together. I've been so impressed with all the collaboration, the reaching out, the donations, just, again, even the food, the masks, all those different things. We're so pleased, and that's what I have for you today. So any questions that I can answer? Okay, thank you so much. Appreciate it.
Thank you, Dr. McGuirk. We appreciate you coming over to Independence this morning and all that everyone is doing at Coffeyville Regional Medical Center. So thank you, and stay safe and healthy. We did have some questions that popped up on Facebook. So one of the questions is, are people staying in their cars during the Parade of Love? So the answer is kind of yes. We want you to be along the parade route. So if you're parking in a parking lot, or you're parking on a side street or something like that, we want you to stay in your cars if you can, or we want you to gather out beside your car or in a location that is just your immediate family. Do not visit with your neighbors, and don't let the kids go, oh, I haven't seen you in so long, and have a gathering. That is not what we want you to do. We want you to experience this parade of love as just your family unit. So please, please do not socially gather and get back together in any way, shape, or form during this parade. Is the grant deadline at noon today? It's on Monday. Is that right, Tricia? Is it at the end of the business day on Monday?
Yes.
Okay, thank you for that. And I have one more question for Tricia. Are nonprofits eligible for the grant? I don't know the answer to that. Do you?
You have to be a retail or service business that generates a sales tax. So from clarification we got from the City Commission. So no, I don't think at this time they would be.
Okay.
But I think that's a good question that the Economic Development Advisory Board will definitely take into consideration in the future.
Great. We will share that question with them the next time that we gather. So, all right, we are ready to move on. Our next speaker is on a call with us every morning at 9 o'clock as we gather with healthcare professionals, the city, the county, the economic development director. We're all on a 9 o'clock call every day, so I haven't seen her in a while, just heard her voice over the phone. But would you please welcome to the podium the director of the Labette Health's Independence Healthcare Center, Becky Mitchell.
Good morning, everyone. Again, I am Becky Mitchell, the director of the Labette Health Independence Healthcare Center. I will apologize a little bit. Dr. McGuirk and I are probably going to touch on some of the same things, just obviously because of the healthcare aspect of this healthcare crisis. Today, I just wanted to take a few minutes to discuss with you about the COVID-19 virus and what it means for the citizens of Southeast Kansas, Montgomery County, and Independence. First and foremost, I want everyone to know Labette Health is prepared and ready to take care of anyone that presents with the COVID-19 virus. As the entire Labette Health group, we are adding beds to make a total of 160 available beds to take care of anyone that is sick and that needs a hospital bed. We have begun to ramp up our PPE supply. PPE is our gowns, our gloves, our masks, our face shields, just getting those all together so that they're available when we need them to take care of our patients. We are also preparing for a surge of patients so that when they come and all the other hospitals in the surrounding areas are full and we have nowhere to send these patients, they're going to be able to stay here in Independence. If you notice some construction out at the Labette Health facility here in town, you'll see that we are preparing to add the capability to take care of about 30 extra patients that we normally would not have the capability to do here in Independence. We are actively monitoring the temperatures of every employee and every patient that comes into our facility at this time. And just like at CRMC, we have begun to limit the visitors to only those that are accompanying a minor, representatives of someone that's unable to take care of their own medical decisions, and visitors for end-of-life support. I wanted to touch a little bit about what flattening the curve, if you guys have heard that term, what that really means. It doesn't mean that nobody is going to get sick. It just means that us in the healthcare profession can take care of those that are sick. If no one chooses to social distance, one patient will affect approximately 2 other people. If those 2 people infect 2 other people, that's a total of 7 people that get sick. But if those 2 people that got sick from the first one, if they stay home, they can't infect anybody else. That allows us in the healthcare profession to take care of just 3 people instead of 7 people. We can handle those 3 people. Those 7 people, it gets hard to take care of. We run out of ICU beds, we run out of medical beds. The ER gets full of patients that are waiting for beds that don't have beds, and it becomes really hard to take care of people that are coming in with new emergencies in the emergency department. In the healthcare profession, we all have important jobs to do, especially in this crisis. My job is to take care of those sick and those injured patients. Your job as a citizen of our community is to help stop the spread of this virus. Those things include staying home and not going out unless you have essential needs. When you do go out, have a plan in place. Get what you need and get home. If at all possible, only one person in the household needs to go. If you do go out, maintain the safe social distance of 6 feet. Cover your cough or sneeze in the bend of your elbow, and try not to touch your face. Wash your hands thoroughly with soap and water for at least 20 seconds, as often as you can, and use hand sanitizer frequently. Clean frequently touched surfaces with a disinfectant at your home and at your workplace. If you are sick, if you have a fever, a cough, or shortness of breath, and you can manage those symptoms at home, please stay home. Do not go out until your symptoms are gone for 3 days and you do not need medicines to control them. If you feel you need to see your primary care provider, please call and speak to your primary care provider first. They may be able to manage you from home. You should choose to seek emergency treatment for the COVID-19 virus just like you would with any other time when you feel you are having a true emergency. If you cannot breathe, you have severe chest pains, or you're unable to control your fever, either call 911 or go to your nearest emergency room. But please be sure to tell them that you think you have the COVID-19 virus. I also wanted to mention a little bit about social distancing. That does not mean that you cannot go outside of your house. That you can go outside for a walk. The sunshine is great for your mental health. You can do some yard work. Walking is great for your physical health. So just remember that you need to stay 6 feet from anybody else. Again, along with CRMC, we totally appreciate all of the donations that have come in, the face masks, the cookies, the muffins. We really appreciate all of that here at Labatt Health. Also the creative ideas of people making the Fab Lab and all the stuff that they're trying to do for us. Very much so appreciated. We all must work together to do our part to contain this virus. I will do my part to make sure Labatt Health is ready to take care of any patient that comes in. Your job is to keep yourself, your family, and our community safe. And that is all I have.
Thank you very much. And again, we appreciate all that you are doing in our community. So thank you very, very much. And I want to echo the social distancing piece that Becky mentioned. We were talking on our call yesterday about mental health and making sure that people are taking care of their physical health and their mental health during this time. So we, as Becky mentioned, we encourage you to get out, work in your yards, take a walk, but socially distance yourself. My mom, as I mentioned, is staying at home as she should, and we are walking with her in the evenings, but we are walking in her neighborhood where we can walk actually in the street area because there's not a lot of cars. We walk on the sidewalk and in the grass. We've been out in the park socially distancing ourselves. Most recently, we've walked in our beautiful cemetery in the evenings with other people. So there are definitely places such as the State Lake, the Elk City Reservoir, and places like that where you can really get out and socially distance and continue to have good physical and mental health. So we encourage you to do that. We did have one question that popped up. Tricia, is there anything for nonprofits federally available?
Yes. And I was actually just looking at that. The PPP does allow for 501c3s to apply for the PPP program. I believe that is also true for the EIDL program. In addition, veterans organizations that are 501c19s are also eligible as long as they meet the SBA size standard, which means in general, you should check with your individual organization, but if you're less than 500 employees as a veterans organization, you are eligible to apply as a nonprofit.
Great, thank you very much for that. And we know you can't see Tricia when she's speaking on Facebook Live, but it is being videotaped by Larry McHugh. It will be on our cable access channel and on YouTube later on today or over the weekend. You'll be able to watch this presentation as well. So thank you for that information, Tricia.
Yes.
All right, we will move along to David Cowan. He is our Public Safety Director for the City of Independence. And I do want to mention the questions about the parade and things like that. We always run everything past David Cowan and Rick Whitson from the county. We don't just create something without checking with them to make sure that it's always safety first. So we have cleared everything that we're doing with them and received lots of guidelines, and we'll continue to move forward with their guidance. So please welcome David Cowan.
Thank you, Lisa, and I appreciate the opportunity on behalf of the City of Independence to speak today. I wanted to take this opportunity to update our citizens on what is happening internally at the City of Independence and all the processes that we are doing to help protect our citizens and our businesses in town. I know you've heard a lot on the other side of it, so I just thought it would be good to talk about what's going on. On March 13th of this month, I went to the interim city manager, Kelly Passeur, and we discussed the current pandemic across this nation. And under her direction, we activated our emergency operation plan at the City of Independence. On March 16th, our emergency operation committee, which is made up of our leadership team, began meeting. And as Lisa has stated, we meet regularly every day at 9 a.m., sometimes more than once a day, every day at 9 a.m. A part of that committee is our leadership team, and we have an excellent leadership team in the City of Independence. Kelly Passeur, our current interim city manager, our chief of police, Jerry Harrison, our fire EMS chief, Sean Wallace, our director of finance, Lacey Lease, public works and utility directors, Mike Passeur, Terry Leibarger, our housing director, April Nett, and the mayor joins us. We also utilize Joanne Smith, who helps us with our messaging and getting our public message out. And due to this event, we immediately knew that we needed to bring in additional resources to this committee, for we saw a critical impact coming to our community. So we immediately reached out to Lisa Wilson at the Chamber, Tricia Perdun at MAC, and Tabitha Snodgrass at Main Street, and brought them into our committee. And that committee is meeting daily and has been via Teams. We Skype in. And I must tell you, this group has worked tirelessly since the 16th to provide support for our community and for our city services. So I'm going to go through a little bit of what that process has been and what we've done as a city. Initially, the group felt it was very important that we take immediate action to preserve our city infrastructures and our personnel. And I realized the current City Hall building has sometimes been a distraction, sometimes been controversy, but has really proven a vital building at this time. We immediately moved all of the administration offices off of the second floor down to the first floor, and gave second floor completely over to emergency services, our fire EMS personnel, and our police department. This isolated our workers from contact with potential COVID patients, and what I'm saying is our fire EMS has already transported 2 positive COVID patients, and who knows how many other patients potentially they have been exposed to. So we wanted to provide that atmosphere that provided protection for the rest of the City Hall staff so that they did not come into a potential contamination from that. So by moving to the first floor and giving them the second floor, it provided that opportunity at City Hall. It also provided the opportunity for our fire EMS personnel to have rooms. We have had 10 fire EMS personnel move in to the temporary City Hall on the second floor. They have families with small children, wives, that they do not want to risk contaminating as they treat and care for the sick in our community. So the building has been a vital asset to us and has worked very well. We have also segregated another part of the building for in case future employees become sick with COVID-19 so that we can care for those. Our city manager was proactive in the aspect that she realized there was going to be exposures or sickness coming, and before the federal government enacted, she enacted, and we worked together to put a policy out to our workers to cover them for up to 14 days if they were exposed with COVID-19 or came down with symptoms that required them to self-quarantine till the sickness was over. This reassured our employees. It reassured them in the fact that we were not making them use sick or vacation time and that we were taking care of them. Part of the move to the first floor is all of the administration, including the manager, Kelly, myself. We have also moved all of housing to the first floor, code enforcement, and court systems to the first floor. Another important aspect of this was we closed our buildings to public access, but we want the public to know, and we have been working very hard, that we are there, we are able to do service, we are able to take online payments and work with the public. We are not closed for business, we are just taking precautions to protect all of our employees each and every day. So please reach out to us, both via social media, phone calls, however you need to get a hold of us. Business is still open at the City of Independence. And we continue to have all of our buildings closed at this time to protect our workers and to follow the governor's executive order. So all rentals and other operations of the city have been curtailed at this time till April 30th. Is that correct, Kelly? Yes. Yes, April 30th of this month. If you have questions or if you have reservations that you had during that time, please contact the city because we will refund those or we will reschedule those events for you. Other aspects that we have been working very, very diligently at the City of Independence is to protect our people and to provide social distancing. So under the city manager's direction, we have worked to create the ability for our employees to work from home and to come into shifts. And each of our departments have taken a very proactive stance to protect our employees. Our city clerk's office is rotating people home. The people that are at home have the ability to work from home, yet we do not have all of that staff in there to potentially be exposed. Our worry is that if somebody would become infected and they were all working together, that we could lose a whole department. We're also working very diligently in all of our other departments to social distance and take care of different aspects of the department by either bringing departments in at different hours of the day or different shifts to ensure that we are able to continue services during the next 3 to 4 weeks, which we anticipate we will see a surge in the COVID-19 activity in the city. Our police department, under the direction of Chief Harrison, has been very proactive in all the aspects that they are doing to ensure that we have police protection during this time by doing different shifts, monitoring temperatures, and different activities of how they interact with the public to ensure the safety of our public, but also to ensure the safety of his officers and continued operations of the department. I would encourage you, if you have questions or concerns, to always reach out to Chief Harrison. Fire EMS Chief Wallace has also taken as much precaution as he can take under our Fire EMS department to ensure the safety of our paramedics and firefighters on a daily basis. As I informed you, half of our staff has literally moved into City Hall and they are living there during this time to protect their families. We have ensured proper PPE is available to all of our emergency services and that they are continually provided with updates on a daily basis. On a daily basis, myself, Becky, and Rick Whitson communicate first thing of every morning as to the status in the community and any information that we need to relay between the three of us. Rick is then able to relay that on to the county health nurse, and then Becky and I are able to stay on top of what's happening in our own community. An aspect that I haven't covered, but I think is probably very critical, is our community. As I said earlier, we brought to our leadership group some people from the outside. The foresight of our manager and the group that this was going to impact our businesses from the start, I think was a very key element. And by bringing Lisa Wilson, Tabitha, and Tricia into our group And the activities that these ladies have done over the past 2 weeks, I cannot say enough for what they've done and what they continue to do each and every day. It has made a significant impact on our local businesses. From the start, we've been very aggressive with Joanne Smith, who does a lot of our marketing and public information with our message about social distancing. These ladies paid personal visits to every business. For the most part, I think we hit every business in the City of Independence, communicating what was happening, what we thought was going to happen, and where the direction was going to go. So far, we've been correct, I think, in everything that we prepared our businesses for. It is a very tough time for our businesses, but these ladies continue on a daily basis to work extremely hard to provide every effort to support our businesses, to get that message out. They created the Indy Facebook page to provide our citizens with information of what's going on and what they're doing, trying to support. I cannot say enough for our Economic Advisory Committee and our city manager and our city commission for their efforts to support our local businesses, trying to keep them together, trying to keep those businesses functioning over the next period. You know, the life of the community is at stake, and we're trying to do everything we can to keep our businesses functioning and moving forward. April and Lacey took on the task as we knew a need in the community would be coming from those being unemployed, those as resources, as businesses closed, that wouldn't have access to diapers or formulas or other needs. They have worked with Vic Gorman at the Methodist Church, and they have set up a food bank and the ability to, for those that need groceries picked up, grocery shopping, or other needs in the community, to meet those needs in the community. The Chamber of Commerce has worked hard to set up the food banking to get food for Vic to utilize. You can drop off your food daily at the Chamber office, and they will get it up to Vic. I believe the hub is doing that for you, correct? And to take care of our community. So I would encourage you to look at the Indy Respond page. The phone number also is 620-331-0719. If you have a need, please reach out to them. You also can call the city offices. You can call the chamber if you have questions about what is available or where you need to go to get something. Please reach out to us because we want to make those resources available to everybody in the community. As I begin to close, I would like to update you of where we are at today. We realize the next 3 to 4 weeks are going to probably become very tough in our community as the COVID-19 virus begins to spread across this country. We continue to make every effort to protect our employees and to provide as much information to the citizens as possible. I am confident to report to you and to our commission that the City of Independence Emergency Services, Police, Fire, and EMS are ready. We have a substantial supply of PPE, and our people are well-versed and trained for what may lie ahead. It'll be vital that we all work together as a team during this time, as the previous guests have told you about social distancing, hand washing, and helping to keep our community healthy during these next few weeks. Kind of skipping over because I don't want to repeat what everybody else has been telling. In closing, I would ask our citizens to say a daily prayer for the safety of our healthcare and emergency services workers on the front lines battling this disease, our nation and leaders for the wisdom and direction, and for those who are ill with COVID-19, and the families that have been lost in our nation from the disease. I want to remind Independence that we will win this victory, we will overcome, we are Independence strong, and we can do this together. The City of Independence is here for you, and we're here to serve. If you have any questions or concerns, please feel free to reach out to us, any of us in the group. You can contact the city manager, myself, Chief Harrison, Chief Wallace, anything that we can do or that we may have missed. The nice thing about our committee is all of the ideas and suggestions that this committee is able to bring to us on a daily basis, and all of the things that we've been able to cover in these past 2 weeks. But we may have missed something. If you're a group or a citizen in need out there, please reach out to us. Please let us know how we can help or assist, and we will see what we can do. I appreciate everything you do, Lisa, and thank you for this opportunity to speak.
David, I know I speak on behalf of a lot of people when I say you are appreciated more than you probably know. Absolutely. We had a question that popped up. This would be directed at for Becky. And so the question was, where are the 160 beds located that Labette Health has? You can go right ahead.
So like I said, we're preparing for approximately 30 beds to be able to keep patients here in Independence. So the rest of the 130 will be at Parsons. They have an old department that they are not utilizing at this time that they are cleaning out to be able to house some patients. If and when we need to get to that point, the surgery department will they'll always have an emergency surgery room available, obviously, but the outpatient department will turn into places that patients can be kept. There's the core, which is where the workout and physical therapy department is in Parsons, and they're thinking about turning that into places that beds can be put. So they're just being creative and coming up with any safe spot that a patient can go. That's we're going to be able to keep them locally as much as we can.
Thank you very much for that. And we'll keep fielding questions as we go along, but we're ready to bring our last two speakers up. They might be speaking in tandem, but we have Carol Muller, as I introduced earlier today, the administrator for the Montgomery County Health Department, and Rick Whitson, the Emergency Management Director for Montgomery County. So, Rick, do you want to go first? How are you guys going to do this? Carolyn, we have Facebook Live set up right here, so we'll let Carolyn go first, and if you have any questions at all, just put them out on Facebook, and we'll field those when they're done.
I'm Carolyn Muller. I'm the administrator of the Health Department here in Montgomery County, and some of the things I was going to talk about has been touched on with other people. So I would like to talk to you about what the process is if we have a positive case. So currently in Montgomery County, we have 6 positive cases of COVID-19. Once we get a positive test, we go into the process of contacting that individual and finding out who their contacts are. Once we do that, we will make contact with those people and either put them in quarantine. We talk to them about what the recommendations are. These people we are monitoring every day with temperature checks and just following up on them to make sure that they do not become ill. So that's the process that we do. We are trying to make sure that we are putting out the numbers to the public on the number of cases we have. I try to do that every day. It may not always match up with what the KDHE website says, but we are trying to make sure that the public is aware of the cases that are in Montgomery County. One of the things that I really want to stress upon is that social distancing and people staying at home if you don't need to go out into the public. If you do need to go out to Walmart or whatever, and there's only one individual that can go that's in the household, then that's what you should do, not try to take the whole family out. Anything else, Rick, that? Nope. You want to add anything?
I'll come up there after you're done.
Okay.
Yep.
So I really don't have anything else. If there's any questions, I would be glad to answer them.
Questions about that? Okay, thank you, Carolyn. And we'll just invite you, Rick, to come on up and speak to us. And like I said, if there are any questions for Rick, just put them out on Facebook, and Kelly will feed them to me, and we'll ask those questions when Rick is done. We'll clap, too.
I expected to get the weakest applause of everyone. And I get the dubious task of going last, so I'll try not to repeat what everyone else has said. But the reality is what everyone else has said is exactly what we all need to do. And I really liked what Lisa said at the beginning of this, and I was sitting over there thinking about that. Everything that she said was about how we need to pay this forward and how we need to keep things in perspective and remember, what business are we all in? All of us sitting here at this table are all in the same business, and that's the people business. We're all here because of people, and we're all here to take care of our people. So we're all here to do the same thing. And to that end, communication is the biggest tool that we have. And I'm not sure that everyone understands what that entails, because there is so much communication that this is the largest event in any of our lifetimes. We may never see anything like this again. None of us have already. So there's so much information to communicate that we spend all of our time doing that. So there's daily conversations, there's phone calls, there's text messages. Our phones just never stop. And I just want to make sure that the community understands how burdensome that is on the people that are responding. Carolyn Muller over there that, we've talked about several times, her and I are in constant contact, but she's also in constant contact with many other people. She's got the KDHE she talks to every day, the CDC, the commissioners, everyone. We're all that way. I started off, when this began, probably back in January, we started off having a conference call every Monday. And it was 30, 45 minutes, just keeping us abreast. And if you're not familiar with the emergency management and how that is, FEMA is the parent organization, Federal Emergency Management Agency. Well, it goes down to every state. And in Kansas, it's called KDEM, Kansas Division of Emergency Management. And by federal statute, they have to have a representative in every county, which that would be me. So that's what emergency management does. Emergency management is the medium for which all resources and communications through state and federal resources come. So on top of that conference call that we had every day, there was also resource requests. How this has grown from January, from that once a week, every Monday conference call, when it suddenly started taking off, probably around 1st of February maybe, somewhere around in there, it grew. And it finally got to where it was every day. And now I have 3 a day. There's one at 10, one at 1, and one at 5. And in between that, there's conversations with all the people sitting in this room, among others. So what I'm trying to get at is how magnificently complex this event is. This is not like anything else we have ever experienced. Tornadoes, floods, ice storms, severe storms, all of those are simple compared to this. This has so many moving parts and so many different branches and things that none of us have ever been through before. And one of the things that I've said, I've kind of used as a demonstration, is we're all building the bicycle while we ride it. There are no experts. No one that you can go to that has all the answers. So that's why we have to have all these conference calls. The conference call we have at 10 is with the lower 16 counties emergency managers. I am the vice president of the KEMA Association for the Southeast region. So all of the emergency managers in this region, we all communicate and we talk about what our counties are doing, things that they've thought of that maybe we hadn't. At 1 o'clock is with KDEM, it's with the governor's attorney, It's with the Department of Commerce, the DOT, the Highway Patrol, the Department of Education, all the Department of Administration. All of these different administrations in Topeka are on a conference call with us, so we can ask questions. When we ask these questions, they put it in printed form and send it to me on a tool that we have called WebEOC. And WebEOC is where I can send questions, they can send answers, and we have it in printed form. Because in order to disseminate that, you have to have some feedback. There's far too much information for any one person to disseminate and understand and sort out. So one thing I want everyone to understand also is that Montgomery County has taken the Office of Emergency Management seriously. And to be perfectly honest, that not all counties do. You know, what our job is when these things aren't going on is preparation. So we have exercises, we have training, we constantly go into exercise and training. By requirement, I have to have 3 a year. Dave has several, so we're involved in them together. And all those is preparation. And we have had pandemic and epidemic exercises. I had a class, my Incident Command 400 class in Wichita. My final test at the end of that class to pass was the bird flu epidemic. So it was beneficial, but how it differs is this is far, far greater than what that ever would have been. And there are other components that didn't apply in a classroom setting. One is how the community responds to these things, and the other is how the government responds to them. Because at no point was there a stay-at-home order issued. So there's just no way to prepare for that. So it's a complex issue. There are no experts. There are a lot of decisions that are made that we don't understand. And part of that is because nobody has all the answers. So one thing that I've found, and one thing I want to encourage everyone to understand, is that sometimes when decisions are made and it seems like a ridiculous approach to an end, it's usually because you just don't have all the information. There's been many times and things have happened and I had no idea why we would have to do that. And then when you learn and find out and you talk to the people that know more than you do, you learn that there really was a reason for that and that it did make sense. So I just want to encourage people to think about that. If you don't understand it, it's probably because you don't have all the information. I found that out myself. But I have been very impressed in Montgomery County, and it's been noticed all the way up to the state level that Montgomery County really has come together very well. Communication is great. You know, we've had meetings in preparation to this where all of the county leaders, the commissioners from the cities and all the city administrators, we all met, we all disseminate information. All the emergency responders, all the law enforcement have a conference call once a day, fire, EMS, everyone. So there are other things about emergency management that make this complicated, and that is what I said earlier, was that all resource requests for all of these different agencies, the hospitals, the nursing homes, the police, fire, EMS, everybody goes through emergency management. They submit requests to our office. We compile those requests and we send them on to the state, and we hopefully get resources. So how this event differs from all others. If we have a flood like we did last May, those floods, tornadoes, ice storms, those kind of things are regional. So there's a region that's affected, and we get our resources from the unaffected areas. But in this event, there is no unaffected areas. So resources are difficult to come by. So far, we've been getting about maybe 10 to 15% of all the resource requests that were sent to Topeka. So that's a totally different, burdensome task that goes along with all the communication. So I have an assistant emergency manager. His name's Lee Miller. And Lee has been a great resource because Lee is also the Lower 8 Regional Health Coordinator. So he coordinates 8 different health departments as well. And he also used to work for the CDC. So all of that has been very helpful. And the county commissioners, they're on the phone with me every day, all three of them. You know, the county has done very well. They've assigned us a couple other people just to manage resource requests, manage social media, the dissemination of information. Because my policy has always been that one of my primary roles is to educate and pass on information to the public. I've always thought that in the absence of credible information, speculation and rumors will thrive. So whenever I'm provided some information, I try to always push it out there. And Facebook is one of the fastest ways to reach the largest number of people. So I have a Facebook page. Of course, I encourage people to look at my Facebook page. I try to put out everything that I can. You know, things that come into me, I try to send them out. So check out my Facebook page. I have a website, the county website. You know, Dave has a Facebook page for the City of Independence. Everyone does. So if you want information, it's out there for you to find. But I have a person that monitors my Facebook page, and she sends me questions that need to be addressed. So I have that resource through the Adjutant General's office in Topeka. They have a PIO person that monitors all their social media, so I've just gave her access to mine, and she sends those things to me. So if there is a question that you need and you can't find the answer to, then just send it to me on Facebook, and I'll always try to answer them at some point during the day. So anyway.
I have a couple questions for you.
Yes, ma'am.
I'll just give them to you. You can read those.
Will we be notified if there's a COVID death in Montgomery County? Well, I mentioned earlier that I try very hard to keep the county updated on all the information that we have. I put out a spreadsheet on everything that happens in the state every day. And I also put one out in conjunction with Carolyn, and we put one out on the county, and we put that out every day. So you'll be notified as soon as we put that out. We had a lot of discussion about this because we don't want to put out so many different notifications that it becomes redundant and people stop looking at it. So once a day really is the best policy. So once a day, Carolyn and I, Lee, and others get together and we put out that spreadsheet. So you'll know certainly by 4 or 5 o'clock when that happens. The other question is, what age group has the most infections of COVID? Well, that depends on what day you look at it, but it appears to be right around the 25 to 45 range, wouldn't you say? What age group has the most infections of COVID?
I think it's a little older.
Do you?
The mean is
53?
Yeah.
Okay, so the mean is 53, yeah. And I'm sure there are a lot of reasons for that, activity. That's, probably the people that get out the most.
Yes, I think a lot of your older folks have underlying health conditions that may put them more at risk to get it.
And I really try to keep things in perspective. I try to get people to understand that the age groups, the comorbidities and other things like that do affect, the death rate, and try to put it in perspective with the population. So it is a serious disease. I mean, my wife is in a vulnerable population. She's currently a chemo patient. She works at the cancer center out at Labette. So I completely understand the seriousness of it, but fear is never the answer, because one of the things that's always made me good at my job is that I don't rattle easily. My wife will tell you that she doesn't think anything bothers me. So, but what I've learned, through maturity is that there are very few things that really justify getting upset about. So, and this is one of them. All we're telling you is awareness and concern, but don't fear and panic. And, another thing I want to leave you with is Walmart is a critical infrastructure in Montgomery County. Both Walmart stores are. I talk to the managers every day out there, and things are going to change. Things have changed, and that usually sends people into a panic, but there really is no reason to, because there's not a shortage of any of those supplies. The only shortage is created by the people that go out and buy it all up because they're afraid of something. So just be reasonable. There's no reason to stockpile at this point. There's still plenty of resources for the stores. Just relax, be aware, and just do your part. Thank you.
Thank you, Rick and Carolyn. We appreciate all that you're doing at the county level, and we'll continue to watch those Facebook pages. I appreciate your posts that you're making. I follow your page. So, we did have another question that popped up, and we will direct this to Dr. McGuirk. Will critical patients be transported to hospitals in other cities? Now, she's mic'd, so you'll be able to hear this over the video, maybe not so much on Facebook Live, but go ahead.
In an ideal world, we will keep critical patients, and we have, as Becky mentioned, at CRMC, we have expanded our capacity to keep a lot more patients than we typically would. We're also following FDA guidelines in order to use our ventilators for more patients than we do on a typical daily basis. So the positive thinking answer would be we will absolutely be able to handle those patients and take care of them locally. However, we have a lot of colleagues. I did my medical training at KU in Wichita, so we have a lot of collaboration, a lot of colleagues there that we can reach out to, and certain patients, when the appropriate criteria is met, will be transferred if need be, but otherwise we'll try to keep as many patients here as we can.
Okay, thank you for that. Anything else that you would like to add? Any of our speakers? Any other questions pop up, Kelly?
There was one on if the critical patients will be transported to university hospitals.
Again, kind of similar answer to that. All the university hospitals are also suffering from, being overrun in terms of their ventilators, their folks to take care of these patients. So it's not really a set of circumstances where we can just anticipate being able to transfer folks elsewhere. Thus, the amount of preparation that we've all been doing here in Southeast Kansas is going to really benefit our patients and take care of those folks here as much as we can.
Great, thank you for that. Well, as Rick said, this is a complex issue that no one person can handle. I wrote that down because it's so true. And when it first broke out, I think we all felt the weight of the world in different ways on our shoulders, whether you were working with the business community or the healthcare environment. I think we all just felt the weight of the world, but we have to all remember that no one of us can handle all of this, and no one of us has all of the answers. We rely on a lot of different people all over the nation for our information. So on behalf of Montgomery County, the City of Independence, their leadership team, the Montgomery County Action Council, the Chamber, Main Street, the Housing Authority, Fire, Police, and EMS, we want you to know that we are all here for you, and we are working to develop solutions to help our community weather this crisis. So please continue to wash your hands, social distance yourselves, stay at home, and only take essential trips. And please have a happy Easter. Thank you for watching. Thank you.
I did have one last question.
Oh.
Is there a need for volunteer nurses?
Are we still on?
On the Facebook Live, we are.
We are? Okay. I can't tell. Okay. So are we still in need of I'm sorry, what did you ask me? Goodness sakes.
There's a question if there is a need for volunteer nurses.
Okay. Is there a need for volunteer nurses is the question. So would one of our healthcare providers like to address that, Becky or Dr. McGuirk?
Sure, this is Dr. McGuirk. What I can tell you is that at this time we are accepting any and all offerings of volunteer services, volunteer supplies, essentially anything at this time. We're not saying no. So there's never a problem for folks to reach out to CRMC, as well as I'm sure Labette, and make their offers known. And if we get to a situation where we need those folks, then we'll already have those things in the works.
Okay. So the answer is a resounding yes from both healthcare providers. They are shaking their heads that they will take volunteers, they will take supplies, anything that we can do to help them out, they are willing to accept our help. So anything else, Kelly? Nope. Thank you for fielding those questions for us too. Thank you very much. All right, everyone, again, stay safe, continue to practice social distancing, and I wish you all a very happy Easter. Thank you for watching.